The biggest bottleneck in your dental practice is you. Not your staff, not your schedule, not your hours, it's you. But as dentists, we're trained to believe if I can do it the best, I should be the one that does it. But let me tell you right now, that belief will cap your income and multiply your stress. You know the day. You've got 4 or 5 fillings on your schedule. You're watching the clock bouncing room to room. You've got hygiene checks. You've got someone waiting on a consult. You need anesthetic in a different room. And then you got an empty operatory sitting next to you. Meanwhile, you're stuck in a room doing MODBLs, and you know you're going to be there for a while. Well, that started to weigh on me. Not because I was so overwhelmed, but because I thought, this is my least favorite procedure to do. Is there anyone else that could do this for me? Here's the exact thoughts that I had. I hate doing fillings, but if I gave those up to somebody else, then our quality would slip. I mean, I am the doctor here. I went to a lot of school. What would my patients think if I wasn't the one physically doing the fillings? What would my colleagues think? Would they think that I was cutting corners? But to be honest with you, that's really just ego wrapped in responsibility. I said it was about quality, but honestly, it was about control. So here's the moment that everything changed. A friend and colleague of mine in a nearby town had an expanded function dental assistant who was looking to pick up a few extra hours at 1 day a week. He told me that he thought she'd be the perfect fit in my practice. An expanded function dental assistant could do the fillings for me? This sounded way too good to be true, but I thought I had to at least try it. The first day that she came, I was nervous. I hovered, I doubled, triple checked, constantly refining and looking at her work. You know what I found at the end of the day? She was amazing. I felt nervous at first, but at the end of the day, I felt free. Remember me telling you about that day with all those fillings and the clock watching, room to room, hygiene checks, people waiting on me, and that empty operatory sitting next to me being unused? Well, guess what? That expanded function dental assistant came on, and that empty operatory was filled, doing the very thing that I was dreading doing every single day. And doing it, honestly, better than me, because she wasn't rushed. That was all she had to do in that hour or 2 hours, whatever time was allotted to her. It was an amazing feeling to know that that operatory was full, we were utilizing our space, and higher quality work was being done that wasn't rushed. And my staff loved it because they weren't working for a dentist that was stressed and burnt out. And that expanded function assistant in that room was working in a way that wasn't stressed or rushed. I'm telling you, this was a powerful moment. So I decided to take the next step. In my state, we have restorative hygienists. They can anesthetize, they can isolate, they can perform restorations. All of a sudden, I had people on multiple days per week doing the very procedure that I dreaded doing every single day. These empty operatories were filled. It was almost like having a mini associate, but they were doing the procedures that I just really did not want to do myself. By implementing this system of, instead of asking, how can I do more? Instead asking, who can do the things that I'm not uniquely gifted at or I'm not energized by? My practice went to another level. Dentist asks, how do I grow? Stop asking that question. Instead ask, who can help me grow? If someone can do something that you aren't legally bound to do, and they can do it initially even 60 to 70% as good as you explore it immediately, and you help them grow into being 90, 100, or even higher, better at this job than you are. So now, this is part of our culture. If the dentist doesn't have to do it, they shouldn't. Anesthesia? Delegate. Fillings? Delegate. Administrative tasks? Delegate. Payroll? Delegate. Think about things that other people can do that you shouldn't be doing. As a dentist and a practice owner, you should be doing the things that are the most high value. Diagnosing, treating, casting vision, and leading your team. Because again, the biggest bottleneck in your practice is you. Listen, you can have more clinical days, you can work more hours, you can hustle harder, or you can multiply. Multiplying only happens through empowerment. As soon as I stopped asking, how can I do more? And I instead asked, who can do this just as good, if not better than me? My stress level went down and our revenue went up. I expanded without expanding my exhaustion. Because the biggest growth strategy is letting go. If you want to learn more tips and practical strategies on how to implement this concept of who, not how, and you want to strategically let things go so that someone else can do them just as good, if not better than you, then stay tuned. We're putting out content every single week on how to empower you as the dentist, which is oftentimes the biggest bottleneck in a practice. Please subscribe, check for more videos. Thanks for watching. See you next time.